And we are good to go. Welcome, everyone. Again, this is Coach Damian Michael, The Shift Method, coming to you with another episode. And like I always say, a special guest. But this one is extremely special because this person, like Coach Lucas Woody, has been a tremendous mentor to me, been a friend, also been a professor, and just a great leader in the field of exercise science, kinesiology, and all things health related. We have Cassi Ledman on the podcast. Cassi, can you go ahead and introduce yourself to the people?
Howdy. Yes, as Damian said, I'm a professor at Purdue University, clinical assistant professor to be specific, in health and kinesiology. Just one of my, I guess, many hats that I wear is being a professor, though I'm also, a health and fitness enthusiast myself. I also am a mom of two little boys, 5 and 7, full of energy and lots more. And I'm married as well, living in West Lafayette, which is the city of Purdue. So
that's right. And you forgot to mention the owner of a wonderful dog.
Oh, yes, and my dog. She's not in the room, so I forgot. Yes, a big, fluffy, black golden noodle that we call a Wookiee when she gets really furry now because she needs groom. So
she's amazing. I've dog sit a few times and she likes to jump, but she is tremendous fun and a pleasure to be around. But yeah, Cassi, seriously, thank you for being on the podcast. This is going to be shifting a little bit of gears. When I talk program design, which we'll get into in a little bit, I come more so from the strength athletic background. And one of our topics today, marathon running, does tie into the athletic background, but it's going to be cool to talk a little bit about cardiovascular or cardiorespiratory training and fitness to give our listeners a little bit of insight on that. But kind of just starting with, you being a professor and just kind of what everything that's going on right now, can you kind of just outline how you yourself got into the fitness industry and ultimately got into teaching?
Right. So I have been an athlete, and I say it like that because I'm an endurance athlete. It's not the same type of description that you would give a basketball, football, soccer, all these agile skills and coordination.
They are athletes, Cassi. Don't play yourself down. Come on.
I am an athlete, but just not that type of athlete. So I've been an endurance athlete, and I've been an endurance athlete since I was probably in 7th grade. I found that out by being better at that than the other track events. So, kind of trial and error there.
Yep.
I have stamina and endurance and not so much speed. So by default, I became an endurance athlete. And I've just always kind of not really understood it as a child, like why I get this feeling of happiness and I'm in a better mood after cross-country practice. And I didn't, know the science or the rationale behind it at the time, but it just was something that always made me feel better. When I was participating in the social atmosphere too, that was also involved. So I kind of got hooked on it then. And then when I was in high school, I took some courses more related to anatomy and physiology and just more exercise focused, health focused classes. And I decided I was going to go to school for something in health. And I thought physical therapy focused, not too far off from that really in what I do, I guess. It's just more of the cardiovascular chronic disease side than it is the orthopedic side. So like I said, I just fell in love with it myself. And then I ended up going to school for it, switching into a very specific health and exercise focused degree at Purdue, ironically enough, as an undergrad.
Learned
about, yeah, that's right. So I'm a black and gold for life. I bleed black and gold. So as you can see, probably, but there's something in the background here at the shirt.
For those watching, she got on the pull or the quarter sleeve, it looks like kind of, and then she's got a Purdue blanket back there too. So
I had to make sure to represent. Then I just went on to grad school to focus more on the clinical world, clinical ex-phys, and worked in both fitness and clinical populations for a while. So I was dabbling in both worlds. I was coaching and working as a trainer in a smaller studio focus, very committed to the holistic approach of fitness and how the mind, body work together and the nutritional components. So that's why I ended up there, but also working at the hospital as an exercise physiologist, working with patients that were getting diagnosed and recovering from heart disease. So
was that through IU Health, or where were you based out of when you did
that? Was when I was in Fort Wayne, Indiana, and I was working with Lutheran Hospital and Catalyst Fitness. There's a plug. Catalyst Fitness is still up and strong. It has more than one location now. Another good mentor that I had that kind of helped me realize, even though I didn't stay there, helped me become like kind of who I am, as a professional. So then I continued to work in this realm, went to the Cleveland Clinic, went to IU Health in the clinical world, working with a lot of really sick people. And it's very rewarding when you get to follow someone through, as depressing as it might seem to some, that you get to follow someone through to getting diagnosed with heart disease, but then you get to follow them through to the outpatient too. I'm not going to say recovering, because they're recovering, but they still have it.
Of course.
So they are mending themselves and building a better life to live a better, healthier life with the condition. So I fell in love with it pretty easily once I started working with patients and clients. But falling in love with teaching was really unexpected. Completely blindsided and unexpected. I honestly took it as an opportunity to do something on the side with teaching while I worked at my most recent clinical practice was at IU Health. In the cardiac.
Before we get any hate, because I know I got a lot of Boilermaker friends. Listen, I'm just going to say it right now. I want all the smoke. Purdue's better, but IU does have amazing programs in health and medicine that partner with Purdue and a lot of their clinics surrounding the Lafayette and West Lafayette area. That's why I asked. We know who's better. It doesn't need to really be said, but just had to make that distinction. Please, Cassie, continue.
We could have about a week ago said, what time is it? And said it's 6:20. IU still sucks. Throwing that in there.
Yep.
That's a little thing that goes on in my house because we're really sure. It's really not out of hate. It's out of rivalry and fun.
It is. It's all in good fun.
But it is funny that you mentioned that because when we first started working for IU Health, my husband also works there and he's even more diehard than me. He would intentionally wipe his shoes on the IU rug when he got in to work.
Oh man. We're gonna get flagged for violent content here in a second.
Hopefully not.
No, I'm teasing.
It's all in good fun.
Yes, it is.
No, but no, they are wonderful, a wonderful healthcare facility. And I just need to be able to advance myself as a professional. And you kind of feel like you get this kind of stuck. So when I started teaching on the side, like I said, on accident, I got an opportunity given to me from a previous mentor of mine from my grad department. He's like, hey, there's anatomy classes and fitness classes that need taught at Ivy Tech. Here's an opportunity in case you're interested. And I was like, no, I don't know. So I'm like, okay, I'll send an email. Ended up working there, ended up doing that while I came home from a 10-hour shift. So this was before I had kids.
Jeez.
10-hour shift would go teach for 2-3 hours, and how do you end up more energized after that? Doesn't make sense, right? So after about a year or two of that, I'm like, I think I might really like this. I think this is what is my calling is to help professionals, young, adults become professionals in a field similar as mine. And that's exactly what I'm doing now. So I got fortunate of the timing of this Purdue job. Both my kids were born. Didn't have to have any of those weird, uncomfortable, I can't be there because, I'm, expecting a kid or whatnot.
Of course.
This position opened up right after my second was born, and I have been here since, and he's 5. So
there we are. Now, you don't still do clinical work, do you?
I do some, largely when we are in full open status at the Ismail Center mostly.
Okay.
Yeah. So we will do stress testing seminars with students. We had lots of plans to do all the chronic condition disease program, diabetes prevention program, stress testing on some of the athletes, and then COVID happened.
Right.
We literally had 4 additional programs to be starting summer of 2020. And there you go. Or spring, depending on which one we're talking about. So fall of 2021.
Yep.
Hopefully we'll get some of these up and running. So.
It's really interesting. We're going to talk about COVID here in a second. So that was a perfect segue. I actually just saw, because we were in a meeting with my other job talking about mask guidelines and how there's been some guidelines that came out. I think it was March 9th, if I remember reading correctly on the CDC website, about vaccinations and mask in terms of if you're in a group of fully vaccinated people, that it is safe to not wear a mask at this given point in time, right? This could change. Who knows what the mutation and the various mutations out there with the COVID virus. But it's looking positive in that regard. And who knows, maybe
that was
fall will
earlier
start
this
moving.
week.
Yeah. I was the first time I heard it was today. And I was like, holy crap. So
it wasn't
hopefully things are trending in the positive.
Yeah, I'm hopeful too. I first read that, I'm not gonna lie, I was like,
I know. I was like,
sure
I had to double check that this wasn't like a fake website or something. I'm like, let me just cdc.gov. Okay.
Yeah, right. And then you make sure there's multiple sources from that, and it's not like planted,
No, of course.
So yeah, I mean, you're right. Hopefully we end up going in the direction of more normalcy.
Absolutely. And with that being said, so yeah, we're basically coming up on the year mark here. I remember around this time, it was March 13th. I went to visit my girlfriend on a little spring break from grad school. She was in Georgia at the time. And then I planned to go home right after. So I was with her for a few days, came back home to South Florida, and then the talks about lockdown happening. So it's been almost a year since this whole thing kind of started with COVID and quarantine and everything. So from a teaching standpoint, I think this is a good perspective too, because I do talk to people from different states. I've talked with my good friend Elias, who was in California at the time we talked about it.
Yeah.
I've talked with other people in Florida, but now to get also another Indiana perspective, what's it been like teaching and making that transition from primarily in-person instruction to going almost fully online? What's that been like?
So I'll start with what it was like before, because it was a lot worse than it is now. Because I'm a very adaptable person, and that's a good thing. However, the amount of adaptation in the short period of time that happened, emergent shutdown, stay-at-home orders, Purdue's not coming back, you need to figure out in a week, basically, you have spring break. Yeah. How are you going to do all this online when my classes are all clinical except one?
Very hands-on, very.
So I was like, I went in ultra hyper freak out mode. Not exaggerating, because this was Tuesday.
I believe you.
I mean by freak out mode, I was like, okay, I got to figure this out.
Yep.
So it was Tuesday, we got the message. Wednesday, we had class in person. That Friday was going to be our last class. I already knew half my students were bouncing out for spring break early anyway. So I'm like, this is the last chance I'm going to have to interact with them possibly on Wednesday. So I made a mission, and I was up to like 1 a.m. figuring out my general plans for every single class. So Wednesday when I went in there, I could talk to them, and I actually handed them a physical piece of paper with, this is my plan so far. This is how we're going to do, lectures. This is how we're going to do these assignments. If we're back, if we're not back, like if we're back, we'll do your evals in person.
So you essentially had to come with like two plans, essentially, like two completely different plans of like, depending on what happens. And I've heard that a lot with whether it's teaching or various jobs. It's like, hey, things are going to change weekly, daily, monthly, whatever. Yeah. Have a plan for worst case and best case. And that's because a lot of work gets thrown in the trash, unfortunately.
Yeah, it was just so much more challenging then because we had no idea this was coming.
Yep.
Like the students were not set up to be in an online platform. We use the learning management system a good amount, but I didn't use Zoom or WebEx hardly ever then. Literally, it was for meetings. I never used it for class, which I've learned how to, clearly.
You are a Zoom expert. You're probably better than I am. When I did that presentation with you, that class, you were putting us in different rooms and doing different like pairings. I'm like, whoa. She's a Zoom expert here.
Ooh, today I was totally on it. I had the rooms already made before they were all even there. I was like,
look at that.
Here we go. So there's your example. If you can plan ahead, I can feel, even if it takes me a lot of time and it's stressful and time consuming to get there, like I feel empowered that I can do it. Mm-hmm. But it was hard because it wasn't just hard. It was so hard on the students. Like they weren't used to this online thing. They had classes that were functioning in so many different ways. Like some were only we were Blackboard then. Some were only that platform. Some were Teams and Blackboard. Some were Google Drive and Teams and that, or Zoom and WebEx. And some were all asynchronous, meaning you don't meet together. Mm-hmm. Some were together synchronous. So it was so hard for them to juggle. At least as a professor, I had the ability to put all of my classes in a similar format. Not that it was easy to do because it was a lot of planning, but a lot of lecture recording, So I think that it was a learning curve. So going into fall, I spent all summer dedicating myself to like, this is how it looks online, this is how it looks hybrid, this is how it looks in person, although I knew it would never be all in person in fall, but you never know. So we basically set up, the 4 or 5 classes that you teach in all 3 ways on a whole new learning management system too. So that was
the thing I was going to say, is that it was already before COVID even was, on our radar. There was the talk of transitioning from the learning platform. For my college students out there, most of you are probably familiar with something called Blackboard or Canvas. So Purdue University was on Blackboard, and there was talks of either going to Canvas, Brightspace, and was there a third one, or was it just those 2?
Oh, like Blackboard Ultra or something, the new version of Blackboard.
Gotcha. And so I've had experience with Blackboard and Canvas. I was already graduating, but I was like, oh, Canvas. I know a lot of people have experience with that from even high school, because it's a very, very popular software. Yeah. And then there was this thing, Brightspace. I'm like, nah, they're not going to pick Brightspace. Sure as shit, they picked Brightspace. So you guys had to learn a completely new format, which, to my understanding, unless I'm just out of the teaching loop in general, which is very possible, is not as maybe well known or not as user friendly as Canvas. Is that kind of the right understanding?
I don't have any experience with Canvas, but gotcha. I can tell you Brightspace is very aesthetically pleasing. It looks clean. It's very modern. It's very there are so many integration options. Like I can integrate Zoom. I can integrate our Kaltura media on it. Like just click, nice. Here it is. It is nice, but like there's so many things to learn of how to do those. Of course, things.
It's a completely new platform for creating courses, which I'm sure did they transfer over from Could you download them from Blackboard, or do you have to build them from scratch?
I did some of both myself. You could request to, I forget what it's called, like export a course over essentially. But there were things that you couldn't bring with it because the grading system, of course, you would have to change over. It was easy in one class to do that because it's a pretty similar framework no matter what. But in 2 of my other classes, I just went completely new. I'm like, we're just starting from scratch. I mean, I had the content, but how I displayed it, and it looks, in my opinion, and we'll see, last semester, nobody was unclear about anything and everything was very clearly laid out. So in all honesty, it taught me how I can do things better, from an organization standpoint. It might feel organized to me because we have all these opportunities to remind people in person and to have all those chances. But when you don't have those chances, you just make it very clean and clear to begin with.
Yep.
No questions asked. An incessant amount of reminders.
Yes, as always.
And nice little videos every week overviewing your week. So if you don't see that person in person, you at least see them in a video each week. I use a lot of video. So some of the students are probably really sick of seeing my video, but some of them might appreciate it. I don't know.
I think overall they will, even if it's a little, redundant, because this is what I tell people, right? And I'll probably mention this more and more as time goes on, because I am working on a little something that hopefully will come out. I won't put our date on it just yet, but a
little sneak peek,
right? And COVID, I don't think changed anything in the sense of where education was going. I think it just accelerated it. Same thing what I talked about with that presentation I did for, I think it was your HK3A team, where the fitness industry was already a hybrid. It was primarily in person, but you had things like Peloton and Train Heroic and various apps like Gymshark or bodybuilding.com, whatever, that offer a virtual component to fitness. It's more affordable, the accessibility is better, right? So these are things that already existed. COVID just kind of accelerated the way in which it was brought to the public and brought to the masses.
Yes.
Education has always had a virtual component for the last however many years. COVID just kind of exposed that, hey, for most majors, not all, but most majors, you don't have to be 100% in person. Now, being that we are a science that has a lot of application and in some cases clinical work, you will never fully replace, right? You can't replace a cadaver lab. I don't care how good your hologram is that you're able to create. I don't care how good your, presentation on metabolic carts is, right? You won't be able to replace labs in that regard, right? You can probably get close with visuals and things like that, or augmented reality or whatever, but probably won't ever replace the real thing. But this did highlight that, at least in some capacity, even in the sciences, you can have online learning and it's only going to get better. Like right now, like you said, hey, teachers, you got a week, figure it out, right? Imagine in 10 years from now, what fitness is going to look like, right? We've already gotten pretty good at Zoom to where we can make it relatively engaging, right?
Mm-hmm.
Imagine in 10 years. Imagine in 10 years what it's like. It's only going to get better. And I say that because I wanted to get your opinion. So, okay, the challenge of going from basically mostly in person with your classes and your clinical portions of the class or labs, and then going to basically all virtual. What would you say was like the most difficult parts that you found with that transition, especially coming from a very hands-on major?
So it's either my ability to provide immediate feedback to the students. So it's, I'm going to say virtually, that's ironic, virtually impossible to have, when I do like a coaching evaluation or I'm trying to help coach them, teach them how to do something, I like to show them how to do like that stress test for that coaching session. And this is Miles.
For those who are just listening, little one just popped in for a minute to say hi. What's up, buddy?
We had to break this.
Oh boy.
It wasn't really one that
You're okay.
it was the back.
Stressed as a 5-year-old. Coloring costumes and bikes, people don't go well together.
Life's getting rough at a young age, huh?
What is it called? A bumper sticker?
Yes.
Bumper sticker. Don't ride a bike while wearing a Halloween costume. I just listened to Green Lights by Matthew McConaughey, and he uses bumper stickers as his like little catchphrases throughout to talk about life. It's good. You should watch.
How many can I have of these?
Okay. You can have 3, and can you go back outside, please? Or downstairs? Well, mommy needs to finish. Okay. Thank you. You can take them with you and put them on the table downstairs. Okay. 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 There's pencils downstairs. Here.
This is your broadcast interruption for the day, folks.
I'm sorry.
No, you're good.
Here you go.
You are A-okay.
Pink pens are way better. Just take that. Okay.
I'm glad we got the surprise guest appearance.
Yeah, I had a feeling that was going to happen. It wouldn't be natural without it.
Exactly.
All right. Well, he's still here, but
that's all good.
I'll just have to message my husband if he keeps talking loudly.
You're good.
Come get him.
So we were talking about, or you were mentioning about like the difficult portions of it. It was immediate feedback was kind of the most challenging part.
Yeah. It was honestly like we've adapted pretty well now that they're able to be in person some. So when we were completely online, like for example, the coaching class, the students that were like literally starting to implement exercise programming and coaching a client, like they had to do it all online. I can't imagine doing that the full semester all online because how can I zoom into that many calls? Like how do I do that? That was what I was trying to wrap my head around. Like, I'm like, that is 10 hours of work a week for me, at least, in addition to everything else, So I'm lucky enough that we had really heightened precautions and Purdue was able to open with high restrictions. So for fall, we were able to come in and they did 1 day in person and 1 day online. So it was a way for me to still interact, still get feedback, still watch them in action. But in the spring, when we had like a month without that, I felt honestly like I wasn't doing as much for them as I could and I wanted to, for the students on both sides and the clients or, participants involved. That was the hardest, and just trying to juggle personal and professional life at the same time. Those 2 things I would say were the hardest components. You can figure out how to have someone record a video and do an eval that way, but I can't, it's just not as raw, feedback, and feels more calculated.
If you couldn't tell, Cassie really, really cares about her students, and not just, them taking tests and them getting grades, whatever. She cares that they actually are successful and can take their skills and apply them practically. Cassie has, like I said, she mentored me for a while. she was basically my graduate advisor in a sense when I was doing my master's up at Purdue. She helped me write. I never published them, but she helped me basically write 2 case studies that we did. I was a TA for her with one of the strength and conditioning classes. We did a presentation together at the ACSM conference in Chicago. That was a lot of fun. I wouldn't have been able to even have the opportunity to present if her name wasn't attached to the presentation. So that was really awesome. She gave me some EKG experience, which is really cool when I did Grandparents University, something I'm sure we'll talk about more in detail another time, because EKGs is something that she's really passionate about and extraordinarily confident with. But I actually got to learn how to apply leads and get some basic reading understanding of EKG. So that was pretty cool. So a lot of opportunity is afforded. And of course, when, everything hits the fan, and not only is your life more stressful, but then all the students' lives are more stressful, it just makes, it's confounding factors that make everything that much more difficult. But you still made it work. So you had the difficult part of that. What would you say you've taken from this that, of course, not to, minimize anything that's happened. COVID has hit everyone in one way or another, some of us harder than others. But I think it's always important to try and take something positive out of a negative experience, right? Even if it's just, I know what not to do now, right? What would you say you've taken from this as a teacher, professor, lecturer that you're going to carry with you moving forward?
That silver lining, the fact that exams are not that important.
I like where you're going. I like it.
Honestly, I have all of them online now, and they are very much written response, case study, explain this, explain that to me. There's no finals at all this semester, Damien. None, 0.
That is wonderful.
Why? So we do projects, presentations. So anyways, essentially what I have learned to value is when we didn't have the ability to do a lot of that applied practical stuff. Like I saw how much that affected like my feeling about it, the students' feelings about it, and how much they missed it, and how that's really what matters.
Mommy told me this is how you make a toast.
So yeah, another quick commercial break, everyone. Don't worry. But yeah, like I was mentioning earlier, while Cassie's, talking to her little one thing that I am working on that's kind of in the university setting is I'm trying to work on potentially making a version of online coursework that is presented to you by the shift method, by me. The goal is to make it a combination of various platforms like ACE, ACSM, NASM, taking the best, or at least what I feel has the most relevant information today from those various certifications, also NSCA, CSCS, and then also taking relevant research on various topics of personal training, and then providing coursework for students. And here's the kicker. Creating this coursework, creating these lectures, PowerPoint, seminars, however I'm going to organize it, the content will be updated. Hopefully, the idea would be as frequently as possible. It could be daily, weekly, monthly, whatever. But because it'll be online, the content will be ever changing. There will be no, you have to wait for the next edition of the textbook. There will be no, this was written in 2014 and it's, 50% of the content is outdated due to the 6 years of research that's now preceded it, or that has come after it, excuse me. It's going to be an ever evolving course, content manual, whatever you want to call it. And that would be the Shift Method University. So that's the potential plan. Give you all a little sneak peek into what I was hoping for, but more on that to come in the future. Just give you a little taste. I think Cassie's back with us now. I think her mom duties are on hold just for a minute. We appreciate her. She is, like we said, a mom of 2 and a wife and a teacher and a dog owner. So the fact that she has enough time to do this podcast is a blessing in of itself. So Cassie, back to you. You were talking about.
Well, that brings something to the forefront. Something else I learned, silver lining, is honestly, Zoom calls and Zoom meetings with students in interactions when my kids were also e-learning, people get to see a lot more of who you really are too, so there's something cool, I think, and personable about that, because it's not something that I'm afraid of. It's just something that you're uncomfortable with at first, right? Like it feels unprofessional, or it feels, but COVID has allowed us to kind of pull those walls down and be like, this is where I am, and this is me as a person. I might be your professor, but these are my kids that are going to run in and interrupt, and my dog is going to bark, of course, in the middle of a really important context with ECG, or so it's allowed me to get to know some of the students, or at least feel, I think, more like just one of them. So I'll say that's another silver lining, is the chance to interact on a more one-on-one level, and via just conversations. Like we used to debrief more in the classroom, and now I'll have one-on-one conversations with the students. It takes more time, but then you can identify what's going on in their life too. You might help identify something that's a really big concern, health-wise, especially right now, from a mental health perspective, especially, that a student might have gotten overlooked if I didn't have these little opportunities. So that's another silver lining. So
it's also really neat too. Like we couldn't be doing this podcast, right? Well, I could fly, technically I could get on a plane and go do the podcast, but me and you can have a conversation anytime, any day, even though we're states away. And in all honesty, like, Zoom calls have gotten pretty good. Like, I know it doesn't replace in-person interaction, but, as long as you got a decent Wi-Fi coverage, like it's pretty good. You get to see friends, you can have a good conversation. There's no length, it's free. So like, it's pretty good. I can't complain.
Yeah. I agree. It leaves so many more opportunities for you to bring in a guest. It's another thing. I can bring in guests for my students from all over. Like you were a guest, you were in Florida. That wouldn't have happened otherwise.
I was doing a presentation in Florida while they're all in their respective, rooms or homes. Some of them aren't even in Indiana either.
Right. I have students that are across country right now, and I wouldn't normally in these classes have that. So it's really, and it also introduced me to the world of online learning and how I can teach a class fully online and actually enjoy it. Never thought I could.
Look at that. Very, very cool.
There you go. There's a little bit, a lot of teaching. Hopefully it's not disinteresting.
No, teaching is important. And I know I even have friends who teach and clients who teach. So it's good perspectives to hear.
Okay.
One last thing on the topic of teaching. You're not just a professor. I know you do a lot of work with the HK department in general. And now that, like I said, it seems like there's a little bit of light at the end of the tunnel. It seems like things are more or less trending in a positive direction. The vaccine's coming out. We're trying our best to keep everyone safe. Do you now that you kind of can see that light, do you have any kind of future aspirations for the HK department coming up in the next year or so?
So actually, this is fun. This is not even planned segue, but we were talking about this anyways. We're really trying to revamp back up our exercises medicine on campus, promote, I guess, awareness. So we've been on hold with a lot of the programs and events and things that we did to engage the campus to essentially what exercises medicine is. Maybe I should put a little framework to this.
Yeah, we can go ahead and go there first. We can do the marathon stuff at the end. Let's go into it.
So, well, basically, I'm a part of American College of Sports Medicine, and American College of Sports Medicine, as a lot of people may be already listening to this know who they are. It's a nationally recognized organization in the industry that brings about a lot of our research, collaboration with professionals. They are like a soundboard, for any exercise professional for years, one of the longest lasting standing organizations, professional organizations. So they collaborated with American Medical Association years back, been 14 years now, to establish what's called Exercise in Medicine. And Exercise in Medicine is an initiative to encourage physicians to start to talk about exercise in the office, to promote exercise in the office. But it wasn't just the physicians. It was this multifaceted approach that was medical professionals, which would be like your physicians talking to their patients about how this is a large part of health and life, not just medications and managing high blood pressure, et cetera, because it contributes to that. But also the community and then campus. So and exercise professionals, campus kind of part of community, separate little segment. So you have your exercise professionals and your health practitioners that need to work together And then the community and campus environments need to be all part of this big, kind of trifecta to promote exercise as medicine. So exercise as medicine on campus is our campus efforts to promote these initiatives. You actually can go through like tiers of being recognized, as an exercise as medicine campus, which we have, and we're considered silver level right now, which means there's gold, or there's bronze, silver, and gold. Gold is our goal, which means we will then also not just have initiatives and events on campus and have it in parts of our academics, but we will also have the health center part of that. They will be talking to students about their exercise, giving them a general program or plan or resource referral. Hey, this is important based upon our discussions, based upon your health. I'm going to refer you to HK to this class, or I'm going to refer you to the RecWell in this program. So we're working on that right now. So it's very exciting for me because we have a physician on board at Push now, which is our healthcare facility on campus.
Nice.
Who is American lifestyle medicine or a lifestyle medicine certified physician. And he is 100% passionate about exercise as medicine and getting all of his colleagues to be all about it and getting even more physicians in, because he's hoping that more students will come, there to need their services because they want, to get, assessed and referred and to better their health,
Of course.
So our whole, initially, what we're just trying to do is, hey, let's restart our bi-weekly walks. Let's get some educational promotional content out through social media, because
is this like your partnership, like working with Silver Sneakers? Is that kind of like one of the facets of it?
Silver Sneakers would be like, I guess, one of the ways that we promote exercise as medicine on campus. But honestly, it's about the students mostly. It's about students, faculty, staff, and community members. But our big focus is on the students and getting this to be a part of campus culture. We want them to know what exercise as medicine is and that it is important. And exercise, truly is nature's best medicine. Not a new concept.
No, not at all.
Like there's Hippocrates. I taught this in one of my classes because it stems all the way back to like Hippocrates. There's a quote where he's saying something like walking is the man's best medicine or something like that. So that's literally saying exercise is medicine. But years ago, it's like it just took so long for us to catch on to this concept, right? So Maria, Mission, and a lot of people on my committee. So we have an official committee now. And we actually had our first official meeting because we didn't really have an organized structure to this before. It was kind of like, well, we'll do this event and this promotion, and like it needs to be more than that. It needs to have roots. It needs to have, like scheduled practices and collaboration. So now that we're allowed to do things more, we'll be more in virtual context and outside this spring, but I have big hopes for fall. And
excellent.
So that's one of my really key areas of passion, if you can't tell.
Very, very exciting, because I know it's something that you've always, I think you even did like a short presentation at the rec one time about exercise medicine. So
yeah, once or twice.
Very exciting. Yeah. And if you're listening and you're like, hold on, so like medicine, exercise, aren't those two things like already like 100% intertwined? I can't remember the stat, and it's going to bother me. Cassie, if you do remember it, please let me know. Mm-hmm. There was like a survey study about like asking physicians, you're like your primary care physician, like, can you list the ACSM guidelines for medicine? Again, the American College of Sports Medicine is like one of the largest, most reputable, exercise / medical or clinical based bodies in the United States, right? It's not like some random organization. People know, even clinicians know what ACSM is. And when you ask them, hey, what are the ACSM guidelines for aerobic activity and resistance training? I want to say it was roughly like only a quarter or something. It was a very small amount. Okay, so there we go. See, I knew there's something in here between my ears.
I don't know if it's about 20% actually talk about it regularly in practice.
Got you. So either they talk about it regularly at a low rate, or even not knowing what they are, which, just quick refresher, ACSM, right? Aerobic activity, you're at least getting 150 minutes of moderate activity, 70 or 75 minutes of vigorous, or a combo of the two. You can double those recommendations to get extra benefits. And then for the resistance training part, making sure can't forget it, because it's actually done less than the aerobic part.
Oh, yes.
Resistance training, you're getting, at least at least training each muscle group twice per week, roughly, give or take, depending on where you read, 1 to 3 sets, 8 to 12 repetitions at a moderate to high intensity, right? That's the basic spiel of resistance training and cardiovascular or aerobic training. And it's not talked about too much in the doctors, right? It's you come in, someone who's pre-diabetic or dealing with osteoarthritis, and, it's not, well, are you exercising? What are you currently doing if you are? Or can we send you to a personal trainer or a physiologist or whatever? That's not the general conversation had in the medical community. And so exercise medicine, hopefully, kind of expands that reach, right? We've even talked about dreams of how maybe one day, again, I'm not a medical or a insurance expert, but imagine if you went to your doctor, they could do like a basic screening of like your health and exercise activity history and write you a prescription to see a personal trainer.
That's the goal.
Like, how cool would that be? How cool would that be because personal training is an expensive thing. Even at places at like a university, like it's not cheap. And, people who are suffering with various diseases, like we mentioned, like diabetes, osteoarthritis, a lot of these things can be, if not fully resolved, at least like improving your quality of life and mediated, making you just have a better quality of life in general, through exercise. And if we can get people to that point, it would make just everything better. It would make our, the economic strain better. It would make people's lives better. It would make, the ability for people to go to work better. It would just improve everything dramatically just to have the conversation.
Right. Essentially, the goal would be anybody, and unfortunately, somebody has to have some sort of indication of at least on the trajectory of disease, right? Like pre-diabetes.
Of course.
Because insurance, we're not there. It's not honored as a preventative measure at this point. However, even at this point, the only reimbursable diagnoses, I don't know every single one of them, but cardiac rehab for recent heart attack, stent, bypass, valve replacement, not even all of them cover all of those.
Which means it's already happened. Like you've already had the issue, right?
You already had the issue.
Right.
Heart failure, already pretty, chronic condition going on there. Oncology rehab is covered by some, and pulmonary rehab. That's about it.
Yeah.
That means, but you have to have a certain severity to get coverage. And I can recall when I worked in this world, like whether somebody would go into what we call phase 2 versus phase 3. Phase 2 would mean your insurance covers it. Phase 1 is in the hospital, just in case anybody's wondering why it's 1. That means they're in the hospital, acutely getting taken care of, people checking their vital signs, assisting them when walking, etc., seeing if they're safe to go home or back to their job, whatever, the screening might be. Not a lot of back to your job in the hospital, but sometimes they ask for that. The physician does. Anyways, side note, phase 2 is insurance covers this with certain diagnoses, but it's not even that simple. It's like this diagnosis with this FEV value, which is forced expiratory volume on a breathing test, they have to really fail it. Meaning they have moderate to severe COPD, not mild, moderate to severe, or they have heart failure to a certain degree. Or they have to already have had the event, cardiovascular event, for example. So it would be nice if diabetes was one of those. If
it's more reactionary than proactive, it sounds like at this point, right?
Exactly. It's what we call secondary prevention, not primary prevention.
Gotcha.
Yeah, and it's only secondary prevention from the mindset of having an acute event or extremely debilitating condition. So it's kind of depressing, but that is, kind of where we're covered right now. But there's some hope on the horizon because, for example, like health coaching is being experimented with as an insurance covered benefit. So experimental with is like doing, I forget the exact terminology here, but something like a level 3 where they're going in and I think assessing like outcomes with those that have received that. So in certain practices. So that's being, kind of tested for, the legitimacy of kind of, there's a chance for like these roles with an exercise physiologist, which is primarily who would work with those chronic conditions.
Gotcha.
Yeah.
That's my hope one day, man, is two things. One, doc can write a script in a preventative, or like you mentioned, a primary way of helping someone. And I don't know if this would help, but this is just an idea to make, in my opinion, our field better, potentially making personal training a licensure. You could probably keep the certifications, because I go back and forth with having barriers of entry, right? Because we're short on personal trainers, we're short on physical therapists. Like we need more people who have more knowledge. But the barrier to entry is so low, and I don't like to say the word risk, but working with a human being is extraordinarily complicated. And I personally don't think that someone who just graduated high school and sat and took an exam with no experience necessarily can work with a human being in the safest and most productive manner. And this is coming from someone who did exactly that, right? I got certified through a accredited organization through NASM. But I read a textbook, took a test, and now they said I can now work with human beings and do, program design and do various assessments, even though I never touched an assessment tool in my life. Is that right? I mean, it's nice that I am now in the ability to help people and I'm protected and accredited, but am I really prepared? So it's an ongoing struggle in my mind that I go through, but hopefully we're trending in the positive.
The entire intention, at least understanding a little bit about the hierarchy of certifications, at least from ACSM, which is very similar with the other ones. Mm-hmm. Sort of similar, because ACSM is very clinically focused, and I think everybody can respect that ACE, ACSM, NASM, NSCA, they're all very respectable organizations. Their certifications are ones aspired for, people hiring individuals. That's who they want them to be certified if they had to choose, accredited organizations, especially those four stick out as some of the most reputable ones. But ACSM of those is definitely the most clinically oriented, which means, for example, you can still sit for that personal trainer exam with a high school degree, with passing the exam. And at present, there is no practical component to it. There's practical questions on the exam,
right?
And videos and assessment. However, you're right. There is no practical sign off. There used to be years ago for all of them, but we're more virtual. I guess we were already moving this way.
Yeah, no.
But the intention is the personal trainer is working with that general population. And then you have to have extra credentials to become what's considered an exercise physiologist certified. Bachelor's level, so needing a degree, which now will have to come from an ACSM accredited through Purdue University, which is the biggest allied health accrediting body there is. So you won't be able to work with these advanced populations unless you come from a source that's providing the curriculum that is required for these professionals. And then you go another level and you go to clinical or registered clinical exercise physiologist, and you have to have a master's or a bachelor's with over 1,000 hours of clinical experience.
Man.
Yeah. Which means these people know what they're doing.
Yeah.
I mean, there would be really hard to get that credential and not. But the problem is, the loophole is, there's a ton of people from the general public that have these conditions that aren't seeking out rehabilitation services, who hire the exercise physiology individuals who have the credentials required to work with those high-risk people. They're just coming right back in a couple weeks, month after having a heart attack, or they have diabetes, and they have tons of risk factors and are at risk for cardiovascular concerns and
you
more.
go get doctor's clearance. They're like, yeah, here's some restrictions, but like, go work out. And it's like,
so
oh crap, this is complicated. Yeah.
And that's where kind of like the gap is. You see what I mean?
I like how you said, like, it almost is like depending on like, this is kind of like one thing I'm trying to do, right? The bridging the gap between strength and conditioning and physical therapy with people dealing with pain and injury, right? Like, where's the scope of a personal trainer there? Maybe we can keep those, I hate to use the word lower level certs. I should say like maybe
not lower
less requirement certs. Yeah. Where it's like, hey, you have a high school diploma, you take an exam, or maybe you do some other stuff, you get this cert, but it's stratified in a hierarchy where it's like, hey, this person sat and did practical sessions for 100 hours. So they have this experience, and this person has a bachelor's, so they have this experience, right? And then the patient or the client, whatever, has a choice. they're informed at least like, okay, well, I know I can afford this, so I work with this level. Or if I want to work in this setting because I have maybe these contraindications, I need to see this person. That would be maybe something interesting.
Sure. That would be ideal. Also, if the organizations could afford the hiring of the different tiers too.
Right.
So there's so many complications. We have this ideal picture, and it would work super seamlessly if all these other working parts, you know, could go together. And licensure, I've learned a lot more. It is not all it's cut out to be. It would provide a standardization.
That's what I'm hoping the licensure increases the standardization or increases the knowledge base, I guess I could say, for the standard trainer.
Yeah, it's just, you can't really try. It's statewide. So you can't go from like, let's say I got licensed in Indiana. I got to go get licensed now if I want to work in California.
That is true.
So
that's like the registered dietitian issue, right? That's like the RD issue.
Right. Right. So interesting. I was recently in the thick of this with research.
Trying to solve the world's problems here, one podcast at a time. Not on this episode, but you know, important conversations to have nonetheless. I do want to go ahead and move on to our final topic because I think I want to be respectful of Cassie's time. Like I said, she's full-time job of 5 different things. So to be respectful of her time, the last thing I want to talk about is marathon running and training. So program design, big thing we always talk about. Really quickly, Cassie, can you just kind of outline like your experience as a marathon runner?
Well, so I've learned from my failures. I've been running for years, but I never thought, even with people running with a running group when I was working at IU Health with my running group every morning, 4:30 a.m. No, I'm not exaggerating. 4:30 a.m. every weekday. And on the weekends, it was like 6:37 weekends. You know, had to sleep in a little bit. That's what you do when you have little kids.
Yeah.
So even 2 of them in the running group were diehard, and they would do lots of marathons. I still was like, nah, it's not for me. I like the half marathon. I like 10Ks. You know, I'm good. And then I got to Purdue, and I was like, I think I got the itch. It's like just the desire to push yourself to see what you can endure, you know, see what I can mentally and physically get my body to adapt to. So I don't have years of experience in marathon training. I have years of experience in running, but not marathon training. So I have actually only completed 2, was supposed to do 5 by now, but injury and then COVID knocked out 3 of those. So so I've done 2, but I've done like over a dozen halves and a lot of 10Ks and other middle 20K, you know, distances in there. So
the injury portion is I think a good place to start because I was doing a little bit of research. The rate of injury in running in general, people have this perception that running may not be safe. It might be, you know, high injury rate. In general, low to moderate distance running doesn't seem to be, you know, a very dangerous thing if you look at it over participation hours. Of course, as the distance increases up to a certain point, specifically when you get to the marathon status, the rate of injury does increase substantially. Not to say that, you know, marathon running in of itself is bad. The issue is because you're doing such a, you know, ultra endurance event, you have to ensure that your programming is, you know, really, really sound. You got to make sure you're taking care of your body outside. And you got to make sure you supplement it with other things like resistance training, which we'll talk about. So injuries, big things, you know, plantar fasciitis, you know, sometimes jumper or runner's knee issue comes about, hamstring, whether it's strain or tendinopathy, not too common because it's more so a sprinting related injury, but you do have a decent amount of lower body injuries that do come from marathon running, a common thing. So, okay, well, how do we deal with it? First thing to talk about, you know, pain and injury side of things, guy I'd like to talk here. Let's think about hamstring and groin injuries. Those are kind of 2 common lower body injuries that we see in sport and running. Again, more so sprinting based injuries, but you can see them in marathon running because the hamstring is a muscle that's used quite a bit and it can be injured. Doing things, we have some good research around doing Nordics or Nordic hamstring curls, very good exercise to help rebuild the hamstring. Doing things that are eccentric based or slowing down tempo and then gradually increasing load over time. And also doing things like what are called Copenhagen's, or some people may call it the adductor plank, for any kind of groin tear or groin pull or strain, might be beneficial for you. If you're not sure what those exercises are, if you just go on like YouTube or Google Nordic hamstring curl or Nordics or Copenhagen plank, you'll see what I'm talking about. They're very difficult exercises, which probably leads into my point that I'm going to, which is adding a resistance training component to help with injury. Nordics is essentially almost your entire body weight and doing basically like a reverse version of a hamstring curl, you can think about it. And then a Copenhagen, you're essentially doing hip adduction in a plank position, a side plank position. So they're very taxing exercises. And when it comes to resistance training, we notice that if you increase your strength, if you increase your participation in resistance training, you can help with or mitigate the risk of injury when it comes to running. There's this perception as well that, okay, if I lift heavy weights or if I lift in general on top of my running, that might be, not advantageous. I'm already dealing with some knee pain, or I'm already kind of putting a lot of miles on my legs. Maybe I don't need to add any more. I would argue the contrary. I would argue if you are doing a lot of running, you do want to supplement it with resistance training to help support you in a strength manner. Cassie, would you kind of agree with that line, or do you have any kind of other viewpoints on resistance training and injuries as it pertains to running?
I will use one word to start with, and it's called balance.
Yeah.
Not balance training, but yes, that's important.
I know what you meant.
But the balance of incorporating in different components of exercise and training all of your systems.
Mm-hmm.
So as an endurance athlete, I am guilty of training my aerobic system because that's what I'd prefer to do, or that's where I think that I'm going to get the most benefit from, is just pounding out the miles and just keep going and going and going, because distance is what matters. I am not the only individual who has been driven by the numbers that my watch gives me, especially somebody, an endurance athlete, a marathon runner, especially. So where did I hear this from? I think I was reading a book, and they, I'll find out which one it was for you. I've been reading a few lately, so something about new strategies of running. Anyways, and this concept of training all systems was brought back up, and it's something I've always kind of believed in, but they use the example of a blind. And you know how with a blind, you have two sides to the blind. Mm-hmm. So if one system can carry you so far, aerobic, for example, which is my primary, area of excellence, if you will, if I have one. Mm-hmm. But after a certain point, the other system continues to lag behind. You cannot progress anymore. So not only are you 100% right, you're decreasing your potential progression in performance. So as much as it might not be your number one go-to, it's going to help you be a better athlete in the area that you're passionate in. So the anaerobic training, the resistance training are all a part of what's required to be the best, to have the best performance. Does it require an hour and a half of lifting weights a day? No. Absolutely not.
No.
20 to 30 minutes, 3 times a week. Keep it simple.
Keep it to a few lifts. Yep. You don't have to go crazy.
I mean, that's what when I got to high,
especially if you're starting from scratch, if you're not doing any resistance training right now.
Right. Yeah, exactly. So if you're a novice to the resistance training component, or it's just something you've only dabbled in, to start regularly participating, twice a week for 20 minutes, if you're still maintaining your running, is probably enough to begin with.
Yeah.
And also, when you get into high mileage, you have to juggle the amount of work your body's completing in all areas. The resistance training for me took a side, didn't go on the bench, but I took a step back from it. I still was incorporating it in when I actually was doing well.
Yeah.
When I was injured, that was not happening. But, when I learned from my mistakes, I dialed down that part while my mileage was high. Still did it, but I had to be mindful of how I incorporated in my weekly long run, my sprint intervals or hills or strides that was working on that anaerobic system. And then the resistance training, like how do all of those pieces work together? And there isn't one equation that works for everybody.
Yep.
And I learned what works for me now is not what worked for me before either. So, it's something that we have to be adaptable with and experiment with a little bit.
Yes. It's funny you mentioned that performance component and how resistance training plays into it and using different energy systems, because if you asked me 2 years ago, when I was kind of, I had a few years under my belt training wise, I worked with a few athletes. If you asked me 2 years ago, hey, Damien, if you had an ultra endurance or a marathon based client, what would the resistance training be? I would have probably exclusively made the resistance training endurance based, meaning it would have been high, not necessarily high volume because the load might have been relatively light, but it would have been high sets or low to moderate sets, very high repetitions at a low to moderate weight with very low rest intervals, because I thought, well, the system is primarily aerobic. Their resistance training should match the aerobic style or the endurance style of their sport. There's a little truth to that, right? You can have, part of your training block can have in resistance training or endurance component to it. But what we see in the research is actually almost the opposite, is that, like Cassie said, you're getting a decent amount of stimulation of the lower body musculature in an endurance fashion just from you doing the sport. The quadriceps are developing endurance because you are taxing them in an endurance fashion, the calves, the hamstrings, etc. What we see in the literature, and I'll make sure to link some studies in the description, is that strength training, right? So force production, high load relative to what the individual can handle, actually improves performance. Now, when you first hear that, you're like, Damien, that makes no fucking sense. You're telling me if I lift heavy, it's going to help me with my marathon running, which is when I'm, how is lifting, 4 reps at RPE 8 or 85% of my max going to help me with a marathon? What we find is that it improves primarily 2 things. One, when you get stronger, your running economy gets better, meaning you're able to do the same work with less energy and produce greater force per stride. So for example, let's just say you're running at roughly, 60 to 70% effort for a marathon. That's like a moderate intensity of what you're trying to keep your pace, right? If you participate in resistance training and you've built that anaerobic or that strength-based component in your game, you're able to carry that pace at a lighter relative intensity to what otherwise you'd be able to if you weren't trained resistantly. Same thing, every time you step, you're producing force. It is true it's in an aerobic way because it's for a long duration of time, but being able to produce more force because strength is a neuromuscular adaptation, being able to produce more force per step improves running economy as well. So having that, that type of training incorporated where you are training strength can benefit you as a runner. It doesn't necessarily improve your aerobic capacity, like your VO2 max, but it just makes you a more efficient runner. And it has potentially that, injury reduction or mitigation, however you want to term it, side benefit as well, because resistance training helps with, bone growth and development, which we know people who participate in ultra marathon or ultra endurance events, they may struggle with that. So having that heavy resistance component could be extremely beneficial to you as well.
Yeah. So the performance concept of VO2 max is what the majority, or at least the majority of individuals that I have spoken to, think that is what drives your performance. So my VO2 max limits me to being able to perform to this level. That is not the only component that factors our performance. My completion time is factored in also by your running economy, which you already hit on, and by your anaerobic threshold, which is not trained in a long, slow run. So you have to do other training. If you truly want to optimize your performance, you have to incorporate in the horrible, if you ask me, because I'm not a sprinter, I already said that earlier, those hill workouts, those sprint intervals, those drills and plyo workouts. Those are some things that have helped me, mounds more than any extra mile I may have done. Plus the resistance training component. I will note that people are kind of wondering, like, well, what exercises do I do? Really focusing on the ones that are going to help the way you move when you run. So you're focusing on the compound movements that are more functional for a runner, squats and lunges and, you know, hip and knee movements that are going to complement, you know, arm swings and movements that are going to complement the way you run. Doesn't mean you don't target other muscle groups. You're still targeting everything. A lot of stabilizing, you know, exercises requiring stabilization.
And like Cassie mentioned, you can keep it simple, especially in the beginning, right? If you're new, you know, you don't have to start with strength training immediately. If you're new to resistance training, you can start body weight if that's where you are. You can start with machine based if that's where you are. That's okay. And then gradually you can ramp up the intensity over time. So, for example, if you're like, okay, I'm working on my marathon, I haven't really lifted weights much. I've maybe done some, you know, circuits in the past, or I've gone to the gym here and there. Hey, start with maybe a couple full body workouts per week, maybe 1 or 2 max. Keep them short. You know, if you have 30 minutes, that's fine. And do your primary lifts. Do your push-up, do your squat, do your lunge, you can even practice, you know, body weight deadlifts or body weight rows or whatever you can do. And then maybe like one core exercise at the end. Gradually build up the intensity over time. Intensity for body weight could be, you know, controlling the tempo. It could be adding reps or sets, at least initially. Once you get comfortable and you start moving more towards free weight exercises like a barbell back squat or a barbell bench press or a standing cable row or a barbell lunge, whatever it may be, then you can start working on strength, meaning the overall volume generally is going to go down, right? Volume is sets and reps, but the intensity, which is going to be load in this case, relevant to you, is going to go up. That can be something as, you know, I use RPE or RIR a lot because percentage of 1 rep max is tricky if you're new to lifting, meaning, okay, you can do anywhere from, you know, 3 to 5 sets, anywhere in the, I would say, you know, 1 to 5 or 6 rep range. And you want to make sure when you complete the set, you had about 1 to 2 reps left in the tank. Meaning if you did a set of barbell back squat for 5 reps, when you re-rack that weight after your set, ask yourself, how many more reps could you have done? If the answer is 1 or 2, probably in the ballpark. If you're like, I could have done 5 or 6 more, might have to bump up the weight a little bit, add, you know, 10% onto the bar and see where you can go from there. In terms of program design, and Cassie was kind of alluding to this earlier, with program design for running in general, it kind of sounds like you were going this direction. Correct me if I'm wrong, but not all your training is just, you know, running 3-4 times a week and just ramping up miles every single time I run, right? You do a combination of longer distance runs, moderate distance runs, higher intensity, short duration runs, and then those kind of progress distance wise over time. Is that kind of like the general formula you do for your cardio training?
Yeah, generally speaking, I used to run 6 days a week or 7.
Man.
I had 2 stress fractures, actually multiple stress fractures, and osteonecrosis. If anyone wants to look it up, it's horrible.
Not fun.
In the talus. Means my bone will never be the same, ever. It will never fully recover. So clearly I wasn't doing something right. So don't do that. My system, with what I was able to do, rest, recovery, nutrition-wise, to complement that volume, was not a good combination, right? It took a long time for my system to respond that way. So it's kind of tricky, you know? So you think, well, I'm doing fine with this. I've always done fine with this. I can keep going. Eventually, if it's a bone related issue, it takes a while. You know, it's going to get to the point where it comes to kind of bite you in the butt. Mine happened to be actually during a marathon, which evidently I ran a marathon on stress fracture. So who knew? It's fine. I did fine, but it did not make my condition get any better. So where I was going with that is 6 to 7 days a week is not required for most people. And there's tons of books written about this, tons of literature showing, yes, if you're an elite athlete and you have the ability to do this recovery and this rest and these long naps, honestly, during the day, yeah, you can do that. And you can do these volumes of 100 miles a week. Not everybody, but a lot of people can. But I am a working individual with a family. That is not in my wheelhouse, right? So for me, and what I'm capable of doing, I can get through with doing 4 runs a week. And those runs look like a run that is kind of what I would call that enjoyable run. That's like moderate to vigorous intensity for 5 miles, just to get out there and get my body to do it. That's also a day I would like do lifting, for example. And then you do a higher intensity day in there. So hills, strides, sprint intervals, kind of rotate those throughout the week. Sometimes you'll do strides at the end of a run too, just to get that system woke up. And then an additional day in there that's like middle distance. And middle distance to some people is not, 7 to 8 miles, but it is if you're marathon training or more, depending on where you're at in your training plan, which is a little lower in, not low intensity. I would say that's kind of where you do what we call more of a tempo run, where you start out and then you push yourself to your anaerobic threshold and then you come back down. So you can do it like that or like a ladder. And then you have that long run on the weekend. Usually weekends work. Doesn't have to be weekend. Just
you said that with such enthusiasm. And then there's that long run on the weekend.
Because it's like a personal escape for most individuals that are really endurance athletes. And even if you're not, you'll eventually learn that is, if you treat it with the right mindset, it is a mental escape. You can listen to things like Damien's podcast and just go out. Yeah. just run, especially now it's getting nicer out. Like it's a perfect opportunity for like you in the road or you in the trail, wherever you are. And there's nothing else to interrupt you and your, mind body connection type deal. So those 4 are honestly kind of what I would call the magic equation for Cassi. So
that's very similar to how I program. Yeah. Is you have like the short, working the anaerobic portion of it. You have like the moderate distance or the tempo, or maybe a long duration interval. And then of course you got to train the actual event itself, which is the long duration. Now, question for you, I'm curious about this because I've trained people for marathons and halves. And this is one that I go back and forth on. Do you think, like, for example, you're training someone who's like, let's just say they're an intermediate person. They have some experience. They lift frequently, they train frequently, and you're programming them for their marathon. And they have a date for a race, and you got half a year, and they're getting ready to get to their race in 6 months. Does someone have to run a marathon in their training block to actually run a marathon come race day?
All right. So there's so much evidence. I'm going to say it depends.
Okay.
Because for me, yes, I mentally need to know.
That's what I was wondering. Cause like from a exercise physiology standpoint, like if you can run 20, you should be able to run 26.2. Right. You should be able to, but that block, that mental fortitude of like, you still got another 6.2, dude. Buckle up.
The evidence or the science side says that all this volume that you've literally put on your legs, your whole body, your legs are just what we refer to because they kind of feel like they power you, although it's the whole body and the brain during your training will carry someone that extra 10K. It's physiologically possible for that to happen, given that they're, fueled and hydrated and whatever, like they should be. If not, then that's going to crumble too. But for me personally, I needed to know that I could, at least be real close. In both of the ones I actually completed, I did over my distance. However, for a lot of people, it depends on the pace you run. So there's like a lot of literature that says it's 3 hours or 3.5 hours, one or the other. If you running beyond that breaks down the system so much that it is not beneficial enough, to warrant having somebody do that full distance, especially multiple times in a training cycle. Because
it's very taxing. The story of the person who ran the marathon, it's Greek mythology, but they died after they ran it. Spoiler alert.
It wasn't even 26 either. It was 25.
There you go.
But they passed out and died. Yeah, it was great. Yeah. Barefoot too, though.
Yeah, that was the problem.
So if you guys don't know that story, you should look it up.
It's a cool story. It's a very cool story, but it's like, it goes to the whole mental side of marathon. It's like the whole origin or the ethos of this crazy event is like the quote unquote first recorded person, or like the first discussed story about it. The person died after doing it. Right.
Yeah.
And if you watch, you can go, I shouldn't be laughing. It's my dark sense of humor, but you see people at the end of marathons, like they hit what's called the wall and like those last couple miles, and they just like physiologically, some people and psychologically just break down, even though they were having a great race. So
you break down one way or the other.
Yeah. So doing that,
there one of the races that I ran it. I don't even remember like what happened for 2 or 3 miles. I literally don't remember.
Jeez.
It just, my body just took me because I could do it.
Right.
I wasn't fueled very well for that one. But I finished.
But you did it.
But that was fine. And then the second one that I ran was a whole nother story. Like I was much more prepared and knew how to fuel. And that's the other thing. I mean, we didn't touch on it. And obviously I'm not a nutritional, and I'm not a dietitian, but nutrition is so important.
Mm-hmm.
And I did not value how important fueling is during training, especially. It's important during your race, but it is so important during training because you have to experiment with how you're going to fuel the days of the race too, the days leading up to the race. The worst thing that's ever happened to me is, and this was only in a half, is a massive like stomach cramp. Like I swear I was going to just pull over the side and like throw up.
Nothing worse than a cramp when you're running then.
At mile 9 in a half mile.
Jeez.
Because I took a gel that I don't normally take. Because I wasn't used to this fueling, and I decided, well, the race is offering it. It's fine. I don't need to carry my own stuff. That's a hassle. No, carry it. Find out, do your research, find out what they're offering ahead of time. And if you're used to it, great. If not, and that doesn't work for you, bring your own stuff. Because it's like you do so much work and you just don't want it to be the one limiting factor, right?
Yeah.
And that's just one part of fueling and burning. I mean, recovering from your runs every week, your lifts every week. If you don't refuel the system, I mean, you literally, like from a physiological standpoint, cannot rebuild muscle.
Right. Well, that's a good point. So like to kind of put like a bow on this, because I know Cassie's got to get going here. So like for our intermediate advanced people, right? Some kind of like take home points programming wise, right? Various runs for your cardiorespiratory training, 3 to 4 days a week roughly might be a good idea to start or to continue. You got your long distance runs, right? So like your actual marathon runs, like you're training the aerobic system primarily. You have kind of your intermediate runs or your tempo runs. And then you have more so like your anaerobic versions of cardiovascular training or cardiorespiratory training, right? Your hills, your sprints, things like that. Resistance training side, ultimately working towards developing some form of strength training. Keep it simple. Main compound lifts that are going to benefit you, that mimic, running and things that are going to develop the musculature for running to help with injury prevention, to help with building strength, and to help with running economy, which will make you a better runner. If you do decide to do both, which you should, if you can, ideally you would do them on different days. Or if you're going to do a run one day, maybe try training the upper body on the same day, so you're not killing your body. And Cassie's right. There's a thing called the interference effect, where we know that it is very difficult if you're an ultra endurance person or a marathon runner to build muscle mass, because the pathways, the metabolic pathways associated with what happens when you participate in that kind of activity makes it difficult to put on muscle. So getting your nutrition right, getting your protein in, making sure you're supplementing with resistance training does show to be beneficial and can help with that. So that's great things to have. Cassie, kind of the last thing, unless you have anything else you want to touch on, we kind of talked about the intermediate advanced person, maybe someone who's already active or training towards a marathon. What do you say to someone who isn't currently exercising or is doing very little, but they're like, I really have this goal or aspiration to run a marathon. Where do I start? What advice would you give them?
Well, if they're not opposed to starting with a smaller distance goal and like working their way up, not everyone does that. I've heard of people going straight to the half or the full. That would be what my suggestion would be, because there's a boatload of couch to 5K programs out there. I'm not saying it has to be a 5K, 10K. So essentially easing your way into it, because if you haven't, especially if you haven't been running maybe just sporadically when it's like nice, like today, it's for example in Indiana it was 60 some degrees today. It was raining off and on, but a day where you see people go out for a run that haven't for months, right? If you're that type of, runner, that's great. There's nothing wrong with that. But if you're wanting to get into a more regular pattern and actually set yourself up for an event and not deal with some of these repercussions that I myself have even had to do with not being more logical in my progression. You kind of put the cart ahead of the horse, right?
Mm-hmm.
Is to start small, start with, you're doing sporadic runs, start with 2 to 3 in a week in a short duration. Don't maybe incorporate in that high intensity stuff yet. That isn't necessary yet. Just work on getting the regularity in. Incorporate in the strength training right away especially if you're already doing it. There's no reason to wait to do that, as long as you're not literally tripling what you're already doing. Don't want to double it either.
Start low and go slow, right? Right,
low and slow. And then maybe you work towards, in 3 months, towards a 10K goal. I'm just going to use this as an example. And I wouldn't encourage you to go to the point of a super intense performance goal the first time either. Go for completing it with feeling invigorated. Maybe that would be the good way to go. And then you can build from that base and then go towards the half marathon distance. Even if you don't do an actual race, kind of follow the template of that and then towards the full. Because I don't have the experience going straight to full anyways. I don't even know what that experience would be like. It would be an immense undertaking. People do it.
They do.
But it's a lot to take on. It depends on your lifestyle. Can you really afford 3 hours on the weekend to go on a long run? Is that realistic in your life right now? If not, it's fine. It'll be there. Work your way to it and have that as a longer term goal later. Just be patient with the process. Respect the process. That's what I would say.
Or else it will not respect you.
I don't know if that helps answer the question.
No, it does. It's
well, she's right.
The overall theme, and I use the term a lot when I talk about like pain and injury people, is load management, right? Making sure that you want to challenge your body, but you don't want to have these huge jumps in intensity, volume, amount of training, right? Start low, start comfortable, start easy. Do a run that is super run. Hey, if you're starting from square one, go for a light jog or even a jog walk of a quarter mile.
Right.
If that's where you are, there's absolutely nothing wrong with that. That's where you are. And then gradually bump it over time. It can be increments of a quarter mile. It can be increments of 1 mile, right? If this is something that really interests you and you're a very meticulous person, I would look up acute chronic workload ratio. There's some mixed research about it, but it seems like it goes to the theme of if you have these huge jumps in volume, the rate of injury seems to go up, which makes sense because your body isn't prepared for that huge spike in training. So respect your body and go at a slower rate.
Yeah, it takes more into consideration than our traditional 10% rule of thumb, because that increasing volume, and then if it's simpler math, you can start with that concept as a new individual. If you're doing primarily one modality, an increase in 10% isn't wrong, but an the acute on chronic workload, takes into consideration what you've been doing over the past month.
Yes.
And then how much this week is in respect to that. So there are, there are negatives to it, meaning what's the volume been like for this individual total? If they're working at this insane volume, then acute on chronic workload is not really telling us the full picture, right? Because their total volume is so high that they're at a risk for injury just in that itself, right? I'm almost done. 2 minutes. Sorry.
No, you're good.
I was getting really excited about this topic. So.
It's a cool topic. It's a really cool area.
And I've used this a little bit, but I really think that I can, I'm hoping to use this, hoping to get into another marathon here soon and to really kind of map this out more that, what is it? 1.5.
You're exactly right.
Kind of the safe, where you go beyond the safe point of increase. So that can be total. So you can incorporate in the aerobic and what you're doing from the strength training perspective together.
That's the cool thing is you can kind of do it with everything. It's so funny. The units are called AUs. It's arbitrary unit, right? So the rough and dirty version of it, again, I'll put a link so you can, so y'all can check it out yourself and read about it. But essentially, like Cassie said, you take your volume or it can be anything, right? So it could be mileage, right? So let's say I run 5 miles in my 1 week, and then you look over the span of a month, 4 weeks, and you take the average volume from that and you get a ratio. So for example, if I ran 5 miles one week and then my average miles over the last 4 weeks was 10, right? I'm going to have a number of 2 because I do 10 miles average over 4 weeks and then 5 miles on the 1 week. That is my ratio, right? The chronic and the acute. If you have a ratio of 0.8 to 1.5, that's considered a good training adaptation zone. If you exceed 1.5, like what I mentioned being at 2, that is indicative that you might be exceeding your ability to recover, exceeding your ability to benefit from adaptation, and potentially being at a higher risk of injury due to improper load management, right? So it is a really cool and relatively easy to use tool that you can apply to any part of your training.
Yeah, I think it's a great way to kind of track, because it's not going to happen immediately. It's not going to happen that week that you log it. It's like a couple, research shows it's a 2 to 3 week delay in when injury onset will actually occur. So you can identify it. That's the plus here. You can be like, whoa, hold up. It has some negatives because it's not the only thing, that you need to factor in. Like I said, the total volume part, somebody's total volume is already incessantly high. Like it's not going to show up in that ratio, right? So you need to consider total volume accrued too. And then also, like it kind of this is the funny part, is before any event, then you would think, oh, I'm at an increased risk of injury because you taper, right? So look at what your workload is, what you're about to go do. Well, that's kind of doesn't apply to that so much.
Yep. It's not perfect.
And you have to
highly individualistic too.
Nutrition.
Multiple
age,
factors.
Skill, all of those things factor in. But it's one good tool that we can use, as aspiring athletes, recreational or avid or elite.
100%. And
to be more accountable to ourselves.
Yes, 1000%. I think that's a good place to end. I've already stolen an extra 10 minutes. I promised Cassie 7:30 and we're here at 7:40. So I'll let her go do her duties. She's got to be, again, she's a teacher, a mom, all those things. So Cassie, really appreciate your time. Do you want to put out your Instagram and let people know? Because I know you do post some fitness stuff sometimes.
Yeah, I do. My Instagram should be just Cledman, CLEDMAN. I'm like, I'm gonna check. It's terrible. I know what my Twitter handle is, but geez. It's Cledman 13, CLEDMAN 13. That's my Instagram. That's what I'm on the most, really. Would be Instagram. Twitter's just more for promotion, like educational components and exercises, medicine, ACSM stuff. So she posts some cool fitness stuff there if you want to follow her. As always, everyone, mine is for Instagram handle _shift_method. You can always head to my website, theshiftmethod.org, if you want to check out blog posts, check out services that we offer. If you're interested in any kind of educational content, again, stay tuned for that because we got things going on in the works there, and hopefully continue making these podcasts for all of you to enjoy. Be sure to leave a comment, like, subscribe, do whatever you got to do. Your support and your feedback is greatly appreciated. And again, Cassie, thank you again so much for coming on the podcast. Had a really great conversation. Really appreciate it. Absolutely. Sorry for the little additional hosts you got in the background.
It adds to it. Thank you, Cassie. Everyone, I'll see y'all next time. Take care.